My name is Ashley Lacey,
And my name is Miranda Wallen.
and we looked at current evidence-based practice in regard to breastfeeding versus formula feeding. As part of our research, we interviewed Melissa Hethcox, who is a lactation consultant at Henry County Memorial Hospital. So, Melissa, what are your views as a lactation consultant on breastfeeding as opposed to formula feeding with infants, and what does current evidence-based practice suggest about that?
Breastfeeding is definitely the best thing for the baby. The body makes the perfectly matched nutrition. If you look at all the things in breast milk compared to the lack of things in formula, it shows you how much more is in breast milk for the baby. It's been evidence-based research that babies do better with the breast milk over the formula. There's a lot more allergies and different things whenever they are formula fed. There are reasons for formula feeding, but breast milk is definitely better for them.
Exclusive breastfeeding provides ideal nutrition for the infant in the first 6 months of life, has macrophages, antibodies, and white blood cells, and provides emotional and physical benefits for both the mother and the infant. Okay. And then, pertaining to evidence-based practice, what are the specific benefits for the mother and infant?
When you really look at it, there are so many benefits that I couldn't even name them all today, but I will name a few. If a mother breastfeeds for a year or more, she's less likely to ever have breast cancer or ovarian cancer. It will help her reduce her likelihood of having postpartum hemorrhage right after delivery. It helps the uterus to shrink down to its normal pear-sized shape. By 6 weeks, it shrinks it down faster. So there's just so many things happening for mom. Then you look at baby, and they're less likely to become obese in childhood, less likely to have childhood cancers, such as leukemia. They do better as far as, did I say diabetes? If I didn't, not as likely to become a diabetic later in life, which research shows that 1 out of every 3 children born last year will become a diabetic at some point in their life. So it's going to reduce that risk. I can't even name all the things that it actually helps with your baby. It helps them have fewer ear infections, less likely to become an asthmatic. There are so many things. They need to look at all the benefits of breastfeeding, and that's just to name a few.
Okay. Maternal benefits of breastfeeding include a reduction in the risk of type 2 diabetes, cardiovascular disease, rheumatoid arthritis, cancer, postpartum depression, postpartum bleeding, uterine atony, and postpartum weight gain. Breastfeeding benefits for the infant include a reduction in the risk of infant mortality, SIDS, diabetes, infections, diarrhea, obesity, cardiovascular diseases, eczema, and allergic diseases.
What are risk for formula feeding for infants?
What we get concerned with formula feeding is that the formula companies have tried to manufacture and make it the safest for the baby, but that's not always the case as far as being safest, because it all depends on how it's being prepared. And so when we talk about preparing it, if you take powdered infant formula, it needs to be cooked by the World Health Organization, and the CDC says that they should be boiling water, having it at 158 degrees Fahrenheit or hotter, making that formula, then cooling it back down, and then feeding the baby. There can be different contaminants in it that people don't even realize. The WIC office said they can't even give powdered infant formula to a baby that was born before 37 weeks until they're 9 months old, because of the high risk for infection that could be. Am I saying that formula is going to be bad? No. But if it's prepared right, and I'm day-to-day society seeing moms that continue to not prepare that formula right and not even realizing the risk. There can be salmonella in it. There's some other, there's a lot of things that could be in it, right, because they can't sterilize powdered infant formula, and people don't even realize that that is one of the risks.
Based on current evidence, formula feeding risks include ear infections, asthma, diabetes, atopic dermatitis, and lower respiratory tract infections. Ways to improve breastfeeding include kangaroo care, skin-to-skin contact, non-nutritive sucking, avoidance of bottles, consistent and supportive staff, environmental adaptations, and education.